Welcome to Align and Embrace, where over 50 years of combined clinical experience meet a commitment to cultural humility and social change.
This episode features a dynamic dialogue with myself, Shyla Bradley, the Content Manager, Engagement Specialist, and Internship Coordinator at Align and Embrace. During this courageous conversation, our founders ask me questions about my experience in the field of social work and healthcare, leading to a discussion on culturally responsive service delivery within virtual spaces.
All right. Thank you so much, Shyla, for being willing to engage in this dynamic dialogue with us. Real
Thank you for
curious to
having
know sorry, go ahead.
me. I just said thank you for having me. Yeah.
Yeah, no, it's exciting. It's always nice to be able to engage with you and have this dynamic dialogue. I find a lot of value when we have opportunities to really just lean in and talk about our profession, talk about our experiences, and really have like knowledge shares and transfers. So thank you.
Mhm. I'm excited. Yeah. Thank you.
Me too. Thank you. Alrighty. So I'm curious to know what inspired you to become a social worker.
So I guess first and foremost, I would say is just my own life experience. Um, you know, I would say that I grew up with a lot of privilege, and while I still hold a lot of privilege in many ways, in my early teen years, I started to develop like very complex medical issues. And now I am a full-time mobility aid user, diagnosed with a disability. And I think a lot of my experience within the healthcare system and just, I guess, within society as a young disabled woman has really led me to a place of wanting to help others. And also just, it really opened my eyes to a lot of the struggles that others experience. I think when I was younger, I didn't quite realize the extent to what people are going through. I mean, as much as a lot of kids don't, but especially just like being in so much privilege, but then, having that experience myself, oppression within this society, it's really made me want to help others, but especially help empower others to help themselves. Um, yeah.
Love that answer. Thank you for sharing that. Um, I never know what life experiences will lead you. Glad it led you to social work. How did you come to know and understand how vital culturally responsive care is?
Yeah, so I would say a lot of that ties into my answer with the last question as well. It's my own experiences, particularly within the healthcare system. Um, I, you know, I started developing complications around like time of puberty, like 12, 13, where it really started to affect my life. And I wasn't diagnosed until I was 19 years old. And so I went through that entire time actively seeking help and seeking a diagnosis for what was going on with me. And I saw like every specialist in the book, and I received a lot of not responsive care in my time. And it was a very challenging experience. And so I would say, just as a patient, I think we've all been there too, having those experiences where our providers are not being responsive. And so that was one thing that led me to it. Another is just being educated within social work. I really value everything that I learned during my time at the University of Michigan during my master's program. Um, just learning a lot about the needs that the people we serve have and the needs that aren't being met within our systems. But I would say the biggest thing is my time with you both here at Align and Embrace. I feel like between my experiences and my education, I had all of the pieces kind of there, like knowing that there was this need for culturally responsive care, but not really knowing quite what that was or what that looked like within practice. And so definitely like participating in the micro learnings and being just kind of steeped in this work with clinicians for cultures has really made me realize like how vital it is and how vital it is to connect all of those pieces that I, found to be important but didn't know what to do with.
I appreciate the, you know, being vulnerable around experiencing what I'm in my brain now thinking about like culturally irresponsive care, right? And that is how I also came to realize how vital it is, as a young Black youth in foster care, navigating multiple healthcare systems and not knowing why, I felt like I'm not being heard or they're being mean or, why are they talking to me like that? Why are people looking? And at 12, 13, 14, you don't know. Now I think it's more prevalent that folks realize, oh, someone's being racist or someone's being biased towards me. But then we didn't really have the language. You just know you were feeling icky in your soul and your heart. So absolutely, I could vibe with that.
Yeah,
Yeah.
and I think I've mentioned before with you all that I spent so much time feeling some type of way in certain spaces, feeling like very anxious and unsure of myself and all of these things. And I had thought for the longest time that it was just uh, like a reflection of myself, like maybe I'm just really anxious or, I just can't handle XYZ in situation. But it wasn't until like my master's program that I recognized you're experiencing ableism. I didn't know what that was really. I didn't understand what was going on. And then it wasn't until working here that I realized more of like the care that I do deserve in those spaces. So not only is that ableism and a reflection of our society and the oppression that we experience, but like I deserve better than that, just like we all do.
Yeah. Wow. And how impactful is that to care, right? Like knowing what you deserve, being able to advocate for yourself. I love that you named empowering because that's so important for individuals to know they have agency. So we empower individuals so they can advocate for themselves. And sometimes we have to help with that and knowing what we deserve and knowing what it should look like. If we're not trained in a medical field, how will we know how that's supposed to look? And then you go in and you're looking to somebody who has studied all of these years that's supposed to know the answers, not really thinking about, okay, they know the answers for their discipline and also how does that then apply to me? So I love the empowering and also just the recognition and also, as Raquel said, the vulnerability and sharing what you've experienced and how you really strive to help other people not experience the things that weren't positive to you and what you've had to encounter. Thank
Yeah,
you.
absolutely. And it's definitely everything that we've discussed and I've learned has helped me not only professionally, but personally as well. And just all aspects, it makes a huge difference understanding this work.
That is also really powerful. And I appreciate you mentioning that because a lot of times we want to take things and we think, oh, we have to compartmentalize and it's only going to happen in this compartment. However, 9 times out of 10, if you're experiencing something in one facet of life, it often is going to transcend into other areas. And so being able to advocate, being able to take agency in a certain aspect of life is very helpful professionally, it can be helpful personally, it can be helpful, socially. So thinking about all of those pieces and bringing them together is really pivotal, in my opinion, thinking about, okay, how can we help people? Where can we help them connect those dots? Because often they may be able to do it in their personal life, but not in their, like, if you're going for like a medical thing, like we're talking about, or in a professional. But the reality is, if you have that skill, you just have to know how then to contextualize it in the different aspects and facets of life. So I appreciate you bringing that up. Now, I'm curious to know, Shyla, I know that during your internship and during your master's program, you did your internship with us, which we benefited greatly, and we loved learning with you, alongside you, and supporting your growth and your learning. And I'm also wondering, in your experience as far as professional, have you worked at a healthcare organization ever in your professional experience? And if so, if you could just share a little bit about where, like, maybe not specific, but like what kind of organization it was and like who was served there.
Yeah, absolutely. So most of my work has been surrounding adult mental health care. And so during my undergrad years, I worked at a like residential group home for adults with severe mental illness. And then for the first part of my master's program, before I started working with you guys, I did about a year full-time as a care coordinator at a virtual mental health platform. And so I was a lot of the like connection of care between my client and their therapists and doctors that they were seeing. And so I was kind of like that first contact. And there we primarily treated like anxiety, depression. There was some ADHD treatment in there. And so it was more like outpatient therapy and like prescription services.
Okay, I recall now. Thank you. Thank you for sharing that.
Yeah. Um, I'm thinking about my own experience working as a therapist with a virtual mental health platform. And so I'm curious about your experience in relationship to um, maybe even during the onboarding process, the hiring process, kind of bringing you into the organization. What did you see, or maybe what did you not see in terms of messaging or communication about the importance of culturally responsive, person-centered care? What was your experience like with that?
I would say it's a lack of experience with that, to be honest. In the onboarding, I don't really recall anything regarding cultural responsiveness or, you know, identity of clients addressing anything in that way. I know like individual therapists would have to go by the regulations of their state. But in my role as a coordinator of care, we didn't ever really address that unless it was a specific thing, I guess. So like, you know, we would have like the therapist would have their demographics laid out so clients could kind of choose someone that would align with their identity, or like see what kind of experience of what kind of like populations therapists have worked with. And so there was that, but there was never anything that we addressed or that was addressed with us in terms of being culturally responsive or helping clients to find that right care. Um, and I would say also there was very little communication or encouragement of communication among the care team. So even if there was, say, something within intake assessments that addressed that, that was not something that was really communicated to people in my role.
And that's really interesting because you interacted and communicated with the patients, right? And so they're interacting with you all and then being transitioned, I imagine, over to the therapist for the actual treatment.
Yes, we were
Yeah.
definitely the like initial contact, the go-between of all of their care providers.
Mhm. Mhm.
And so I tried to take my time to look into the notes and everything from therapists and their doctors within their medical records. But that was also something that was not, I guess, prioritized. Like we were encouraged more to focus on responding and getting like a message sent or responding to an email from a client than taking the time to understand the client and their needs and their background.
Wow. Yeah. Interesting. And I think every place is so different because I've had a lot of different experiences across different healthcare organizations and people serving entities. And what is asked and what is expected is totally different. Because I know some places like, yes, look at all the information, and it's encouraged that you try to go in as clear as possible to make your own assessment. And then some people are like, hey, make sure you're taking all these things into consideration as you're, formulating an assessment when you're engaging and trying to figure out how to best serve individuals. I'm curious to know um, what type of messaging and or training was required or encouraged from leadership when you had um, these experiences.
Uh, None that I know of, to be honest. Um, and actually, this was something that was brought up during one of my team meetings. We had like teams of coordinators, and once a week we would meet with our management to discuss just new announcements, things that are going on, concerns that we have. Um, and something that a coworker of mine raised was that we should be doing diversity training. Um, Not only people in our role, but basically every employee or person hired on should be going through some sort of diversity training. And that is something that I voiced my agreement on. Um, but it never really went anywhere. And it is actually something that I would re-bring up whenever I would experience an issue, of where my client wasn't being treated right. There was an issue of cultural irresponsiveness. And so that's something that I brought up many times. And it's hard to know if that was ever taken seriously, because I felt in that position a lot of like I was just kind of another number within the employees. And a lot of times I would bring up concerns and I would hear something like, yeah, that's a good idea. I'll bring it to upper management. And then I would never hear anything. And even if I would kind of come back to it, it would kind of disappear into the system. Um, and you know, I even like had an issue one time with a client who was trans, and one of their therapists uh, was not being responsive and using incorrect pronouns, both to the client and in their records and their notes. Um, and, I brought this up and I mentioned again hey, let's get some diversity training. This seems to be a common issue because that was something that I experienced a lot actually with my clients. And I just, it was kind of treated like an individual issue, like with that therapist, you know? And so to me, it seemed more like something that needs to be addressed on a larger scale. But I think a lot of times with the focus on short-term solutions to just like get through the next thing, the next day, I guess it's a lot of the things that I would bring up in regards to this were just kind of pushed to the side.
Oh, that's really, should I say, profound for me when you thought, especially when you tied in the short-term solutions. Makes me wonder, knowing like this is where the field has been evolving to and continuing to move to, like, fast and try to get these fast, quick, effective intervention solutions. Like, where do we strike the balance so that we're able to navigate service delivery in a way that is culturally responsive? Just curious to know if you have any thoughts on that.
Yeah, I think that's just a big issue a lot with these types of platforms. I think really what it is the goal coming into it is access. It's easy. People can like sign on and connect with therapy and medication services with a few clicks of a button. And that is fantastic in terms of more widespread access to the services that people need. But I think when the focus is on just trying to improve that access and get that done, we are missing the responsive piece. We are missing the opportunity to really connect. And I think that's just something that needs to be reimagined in general as we're switching to a more virtual space for services in general. There's that lack of communication and there's the instant gratification that everyone is looking for with these kinds of services. But healthcare, mental health care is not an instant gratification kind of thing.
That, yes,
It takes
for sure.
time and
Yeah,
effort.
yeah, I love that. And I think it's important to set the expectations, the level set what it is that people are looking for and making sure that they understand realistically what can be accomplished and what can't. And also taking a few extra minutes for that connection that you're talking about, because that makes the difference, we know, in the effectiveness as far as the support, the treatment, the intervention, whatever we want to call it. But that is what determines the outcome typically in these types of relationships. What is the connection to the person that is serving the individual? And how do you do that in a virtual environment, being responsive, understanding all of the variables that contribute to somebody's cultural frame, and making sure that, it's not lost on us, taking the time, slowing it down. And sometimes
Yes.
it's hard because that's the pressure that people are under, especially in the work environment. So thank you for that.
Yeah, absolutely. And I think, too, on top of taking the time with the individual client, something based on my experience that I think is really needed in these spaces is taking the time among the care team to communicate. I think, at least in my position, the only time we would communicate about a client is when there was something that needed to be addressed. I needed to schedule an appointment or I needed to, request a refill of medications for them when really I feel like there should be a space to sit down and connect over your shared clients and, make sure we're all on the same page about the care plan. That makes a huge difference. So taking the time with the client and taking the time with your team, really.
That's really powerful. You know, I was supporting folks in the virtual space and telehealth when thinking about, well, what does it look like in a telehealth environment, right? How do you slow down, even like during the intake? And really, it's just intentionality. It's intentionality with weaving in questions from the beginning when you're first, connecting with a client. Hey, my name is Raquel Neal. My pronouns are she and they. Please let me know what is the best way that you want to be referred to. Boom, right? Like it's just these small ways of weaving in. Tell me a little bit about your culture, anything at all, anything about your identity. What's important for me to know. This can even be on the intake form, right? And then you have the information when you meet with the individual and you can expand on that during the conversation. And interestingly enough, I was really intentional around doing that in any environment, but particularly virtual, because once that first intake was over, we rarely ever had another opportunity to get on Zoom, right? A lot of it was chat
Yeah.
therapy, which makes it even much more challenging to bring them who they are wholly into the conversation, because it matters. If something's getting in the way with sleep, if something's getting in the way with food, diet, if something's getting, whatever's getting in the way, whatever treatment goals we're working on, their cultural experience and paradigm need to be interwoven into that intervention, or it's just another intervention, right? It's a one size fits all. And what while that was and I think one thing about me, my success rates in terms of folks um feeling value from the program was high, but I had a lot of feedback around, you're not seeing enough clients. You're not seeing enough clients. You're not billing enough. You're not
Yeah.
billing enough. Right. And so that was a hard conversation to have and to hear that billing took preference. And of course, they would say, well, we got to keep the lights on. We got to keep the lights on. Right. And so my question was, do we keep the lights on at the expense of folks coming for help and support and not giving them the support that they need, but giving them the support that you have and just offering that and focusing more on billing? Like, how do you square those values? And I'm no
Yes.
longer there, but that they never gave me a great answer.
Yeah. And everything you're saying is completely relatable in my role. You know, the main part of my job was answering messages. That was like how my day was structured. It was around answering messages. And that was how our like productivity was measured. And so when we would meet, they'd go over like how many messages did you answer on average in a day? And for me, it was more important to, okay, review their records, see what was going on, see if their therapist or doctor had mentioned anything that would allow me to answer the message better and provide all of the information that they would need in one response and be able to do that versus just responding and then they come back again and respond again and they come back again. And to me, the focus on just getting it done and moving on was just so, outside of my values of what I was trying to do in that position. Because, I got into that role because I care about mental health and I care about helping people. And so a lot of the times with the focus on billing and productivity and just getting to the next thing and getting more clients to sign on, it left me feeling like I wasn't actually helping anybody, that I was just going through the motions of my job. And on the reverse, I know that it probably was leaving my clients feeling like they aren't getting the help that they need. And so I think all around, care team, clients, the type of system that's set up in that way is leaving everybody feeling not so great about what's going on. Um, and so while that's great, like having the option to do the messaging is incredible for so many people. Um, but it needs to be set up in a way that's going to be more effective. And
Mhm.
even just having regular check-ins and making sure we're addressing those cultural issues. And not, making the care team feel bad for taking the time that they need.
Mhm. Mhm. I agree. I recently signed up for, I can't remember what it's called, but it's like EAP, for a couple of reasons, right? Our organization is going through some serious culturally, an organization I'm affiliated with going through some serious cultural irresponsiveness. And it's having a huge impact on people, on individuals, right? And so I imagine the impact that you had mentioned, the implications of how clients are left feeling, and not having the connection that they need. And so I signed up, and the therapist called me and they were like, yeah, I'm just calling to schedule or something like that. And I mean, literally after like, because they didn't know I was also a therapist, I don't know, maybe 5, 10 seconds, I was feeling like, I don't want this person, right? It's something about, and then I was like, okay, is that a bias, right? So I'm trying to go through my own self-awareness and self-examination, seeing if something, is coming up for a particular reason, or right, just kind of wrestling with it internally. And I told them, I said, I'm out of the state right now, so I'm not able to, you know, get treatment, and I'll go ahead and schedule when I get back in California. And they were just like, okay, okay, okay. Well, can you answer a few questions now? Can you, like, very pushy, very agenda oriented, right? Very much content focused, right? Not even, I don't even think they asked me how I was doing today. It was
Wow.
just very much like, oh, you want treatment? Okay, let's schedule. Okay, you can't meet now. Okay, when can you meet? It was very much, let's get to this end result. So I'm going to stay with that individual because now I'm just curious of how my, process is going to go. And, while I don't feel that I meet diagnostic criteria, or I would probably shift gears and go with someone else. I'm really interested how this person who I am making assumptions about their identity, and I don't want to say it because I don't know, but I made an assumption, and see how they transition me through their process. So it'll be really interesting. I'm curious, Shyla, what you think, you know, talk to us a little bit about the impact that you experienced, that you saw on clients or your colleagues as a result of the cultural irresponsiveness.
Yeah. Um, I would say definitely the impact on the clients is that a lot of them dropped services because of their experiences. And that's the last thing that we want for somebody who needs help and is because taking that step towards getting treatment is huge. And it takes a lot of courage to be able to get there. Um, and then, having that irresponsiveness make you feel like you need to drop those services is just devastating. I even had one client who said that they were already nervous about starting therapy, and just this experience made them realize that therapy is just not meant for someone like them, and that they not only were going to drop with the company that I was working at, but just not going to seek care anymore. And that was heartbreaking, and I was trying my best to do what I could to, resolve that, and even give like recommendations for other places, or, my first step was trying to give recommendations for other therapists within our organization, but then even after that to other organizations. But they just, it put a bad taste in their mouth for treatment as a whole. And so I think that is the last thing that we want as clinicians, is for people to not seek the care that they need. And so that was the biggest impact that I saw. Um, and then for employees and clinicians there, the stress really, it got to all of us. It was very difficult to keep signing in to work every day feeling like I am not helping people, and feeling like everything that I was doing was just building up more of the stress rather than resolving it for my clients. Um, and so that was, yeah, just really difficult. And I think also it made a lot of people show up to the job on edge. And when you are feeling that way, it is very hard to respond appropriately to your clients. And so, you know, feeling stressed because there's cultural irresponsiveness, and then how can you be culturally responsive when you are on edge, you know? And so it was just like a very, um, I guess, vicious cycle, I think, that really needed to be treated at its source, but it was being treated as individual issues.
Wow. Yeah. Great points, great wisdom. What came up for me in the first part of what you were sharing was I have been in a situation in the past where I started as a private practice, and it evolved and it became fee for service, and it kind of like, whoop, woke me up when you were saying what you were saying, Raquel, because I know that like that was part of the business practice. Is like you can get paid a base, but you only get paid based off of who you see, because that's how the pay source is. And so that was one of the reasons I got out of it, because like got into it to help, not, make people about their help about, a price tag. And it just became very challenging to give quality care. And I don't care how much money you bring or don't bring to the table. I feel like for me, that's a value I didn't really want to waver on. And then thinking about, okay, evolving and having, a smaller practice now, one of the things that I had instituted, which people are like, well, I don't have time for that, or I can't, do that. It's, offering a free consultation where you meet with somebody for 15 minutes. And sometimes it goes to 30, but for me, investing that time on the front end is so important to the field, right? And it also encourages retention, connection, all of those things. I've had very minimal no-show rates. I've had very minimal follow-up, and giving people an opportunity to say like, okay, I like the vibe, I like the theoretical framework that you're operating from, and I feel connected. And also in a virtual environment, I think it's even more so important. So as you were talking, it made me think like, wow, I never even thought about that as being like a culturally informed practice, right? Because you just have time. There's no pressure. It's like, asking questions, sharing information so that there's an exchange to determine, is this a good fit for both? And not every organization, service provider has that option. Because, when you're a small private practice and that's like your sole source of income, it's different versus this is your sole source. So just wondering, like, also thinking about how can you get there, because you will have greater show rates, you will have greater retention, and that impacts the bottom line. And also the most important thing is I don't want to have somebody show up and pay for a service and then it's not a good fit for them, because it is a detriment not only to them but also to people wanting to get help. So when you're saying, somebody says, well, I don't think that therapy is for me, all therapists are not created equal, including us, so everybody's not for everybody, and that's in lots of different facets again of life. However, we don't like just taking people just because it's not a benefit often for people. So for me, thinking about all of those things having the ability to reflect on previous experiences and who do I want to be today as a therapist? How do I want to make sure that I can have an impact that's positive, right? Because I'm just a catalyst. People have to do the work. So that's also an important thing. So anyway, it just came up for me and I thought I'd share about it because what you're saying is very true. And I understand not everyone has the opportunity or the privilege to do that. I'm just trying to figure out like where do we move it from the privilege to our responsibility, a thing that we must do in practice. Because what for me, I always will say is like this isn't about me, it's about the individual getting what they need. And if I can support that, wonderful. And I need to also understand what's happening before I say, yes, I can support it. And that's also, again, knowing yourself, knowing your limitations, knowing what your strengths are to support somebody else. Um, and also making sure that people understand like the most important thing is that you get the support and the help that you need. And I encourage people to interview therapists and do all that. But when somebody needs help right away, they need help right away, right? So they're going to go, they're not thinking of all those things. So there's a lot of variables that play into how people land in certain scenarios when it comes to therapy. And I think that's where it's the therapist or the service provider's responsibility to slow it down and to make sure it's a good fit. Because if they don't and it's not, it could sabotage, it could erode the person's desire to ever engage in therapy. And that would be very sad. And it
Mhm.
happens all the time.
Yeah. You know, and that makes me think a lot about the model that was used, the care model that was used at the virtual platform I was working at, because basically every client who came in would be assigned a prescriber and a therapist or counselor, and then a care coordinator, which was my role. And their first step was to see the prescriber, which a lot of times would be like nurse practitioners, physician's assistants, or MDs. And that would be the intake. And it was very medication focused because that was also part of the services that were provided. Like, medication would be sent, would be like mail pharmacy kind of sent out. And so it's I would have these clients that would sign up, they would do a intake appointment with their prescriber, get a prescription, medications, and then later on settle into, you know, finding the therapist and getting the rest of the care plan going on. But, you know, to me, it felt like there wasn't that opportunity to see if this was the right care plan for them. There wasn't that initial like intake and an assessment with a therapist, or even if there was other like types of coordinators or caseworkers that could come in and first see what the needs are. But this kind of billing subscription based service was like, this is the package of what you get, so that's your care plan. You get medication and you get therapy, and that's how it goes. And, obviously, if a personal clinician felt like medication wasn't right, then, you'd go from there. But that was the baseline. And it definitely just seemed like there was a big missed opportunity to connect to see what was really going on. Um, because even as we mentioned earlier on this call, I had said that there was many times in my life where I was just feeling very anxious and overwhelmed in certain situations, and I didn't realize that that was because I was experiencing ableism. But once I learned about that and was able to talk through it, I'm so much more empowered in those situations, and I'm not nearly as anxious as I used to be. Now, if I just went in seeking treatment and was like, I am experiencing these symptoms of anxiety, I could have just been medicated and moved on instead of actually getting to the root cause of what was going on in those situations, you know? And so, yeah, I agree with you. Anyways, that whole tangent of that, like, just to say, I truly agree is like, we need to be treating individuals, not, you know, treating a diagnosis, basically.
Ooh, and that's the thing. With insurance, you have to have a diagnosis most times. So that's where the challenge comes in. It's like, in order to see somebody, in order to provide them support, they have to fit in these boxes. And I think that becomes very challenging for a service provider who really wants to be culturally responsive in their approach. Because if you don't hit this checkbox or you're not able to check it, you can't get paid. So it like you said, it becomes a bit of a cycle. It's great
I think
conversation.
the root cause analysis is actually key to what you said, Shyla. Like, I think that was my worry when folks were getting prescribed medication before I was able to see them, because then I can't see them from the perspective of how they were showing up. I'm now seeing, a modified version of who
Yes.
they are based on the medication, and which makes it much more challenging to get to the root cause, right? So I think I was like, wow, that flipped upside down model of care, which is let me put a band-aid or some type of covering, because medication really, for a lot of mental health, it's a covering of symptoms or masking of symptoms. And definitely, I know how valuable medication can be, depending on what diagnosis that you have. But I always worry, particularly around generalized anxiety disorder or depression, right? When folks immediately go to medication without having that, what Dr. Kara mentioned is that kind of discovery consultation, and really seeing if it's a good fit and seeing what that individual truly needs. I have had clients who would very clearly, I don't want medication yet. I want to see if I can do this. I want to have an opportunity to put some things in place in my life. And so, a part of what Align and Embrace does is support individual therapists, practitioners, clinicians, and organizations with really looking at what their values are, right? What their organization values are, and how are you aligned either in your professional, personal, and organization values with the outcomes and the impact that you say you want to have. And what we find often is that while well-intentioned, values around being trauma-informed and person-centered and, all of those things are on the websites, right? The actual, what it looks like in practice, there's a mismatch, right? There's a huge gap, and corporations and therapists, even in their individual practices, they have to feed their families, and they have their rationalizations and their justifications for continuing. Well, just get more clients. Let's just get more clients. Let's just get more clients, as opposed to how do we flip our processes and our practices and our procedures to be so trauma informed, client centered, and culturally responsive that we retain who we have. Right? We retain who we have. They see the outcomes that they desire. We celebrate their successes, and then we move them through being self-sufficient and always come back when needed. But not this, kind of what are those things where people just kind of car processes, where like a manufacturing line of individual people, and whoever works and whoever sticks, and whoever doesn't will just get more clients. So we're really, really focused on supporting individual therapists, clinicians, and organizations with the kind of flipping their processes and really building dashboards to see, are you having the impact that you say? Is your organization, are you living in your values, and are you having the impact that you want to have?
Yeah. I think, and we're talking about the manufacturer line, like kind of like an automation and certain things we want to take universal precautions for, right? But not when we're talking about individuals who are all different and have the variables that we know exist.
Yeah. And, I think that really speaks to how powerful the work is that we do at Align and Embrace. I'm thinking about what you said, Raquel, with aligning with values. A lot of these organizations have these values, and even, clinicians too. And it's like you have a goal for what you want to achieve, but don't actually know what that looks like in practice. And that was something for me as well. There was many things that I tried to recommend to management during my time in that role. Um, but I think having now gone through a lot of the micro learnings and courses here at Align and Embrace, I have more information to kind of like what that could look like and what that actually means and translates to. And so I think, having these trainings is really powerful because it's like we have these goals, and a lot of people who get into this kind of work, whether it's like management of the organizations or clinicians, any employees, like we all want to help people and make a difference, but actually making that happen in practice is a lot more difficult than it sounds.
I think you just wrapped us up in a bow, Shyla. I appreciate that. And thank you so much for sharing your experience and your wisdom. So great to be in communication and have this dynamic dialogue. Dr. Kara, how would you put that final touch on it for us this morning?
I mean, she hit it. Boom. That practical application is where it's at. And I love all of the conversation. Appreciate just exploring what we've experienced, where things could have been done different. And that is where the rubber meets the road. What's happened has happened. The things that exist can exist. We have the opportunity to make a difference, to change, and to shift this paradigm and how care is delivered, how we support each other, how we have dynamic dialogue. This is how we get there. This is the practical application, Shyla. So thank you for bringing it in and tying it up in a bow because you're absolutely right. How many years? Over 20 something years I've been in this field. And often I have to pick up that phone. It's like, hey, Raquel, I'm encountering this. I need to just talk about it. How do we lean into the conversation? I feel real uncomfortable, real prickly, and I know it's okay to be uncomfortable, and that is telling me something. I need to lean in. I need to figure this out. I don't want to blow anything onto anybody. So let me do my introspection, my examination, my interrogation for myself before I bring it to somebody else, whether it's a client, whether it's a coworker, a colleague, making sure that I'm attuned. Because as you mentioned, Charlotte, it's so important to take that time to connect with the people that we're serving, to connect with the people that we are serving with. And I want to also add to connect with ourselves, which is what we talk about in crystallizing my cultural frame. Because as we connect with ourselves, then we're going to be more attuned. We're going to be able to regulate our emotions, our responses, give ourselves the time and space to feel and honor that, and then lean into the grace that we've been practicing. And Raquel, it's like always the thing, like I want to strive to do this, and the grace is so important. And it's initially I'm like, what does that mean? How do I show myself grace? But it's really like allowing myself to be human, allowing myself to have feelings, and also exploring and being okay with whatever comes up, and knowing that whatever comes up, if it doesn't feel right, I don't have to do that again. Meaning I don't have to carry that forward, but I have to work through it. It doesn't go anywhere on its own, because when you just think that you're gonna stuff it, then it becomes more of that Band-Aid approach that we're talking about. So how do we get to that root? And sometimes it takes multiple occurrences to continue to chip away at whatever it is, because a lot of it is deeply rooted as a result of our experiences, as a result of what's happened in the past. And as we're able to navigate that, it just makes us have an increased capacity and ability to show up for ourselves and for others. So that's what I'm going to end with. Thank
And
you.
yeah, thank you both for having this conversation with me. I just want to say, like, every single time we do talk, whether it be just amongst leadership or with our whole team, it's definitely been an opportunity for self-reflection and just gets me continued and more excited about doing this work. So thank you.
Well, you're certainly a gem, and they need now more than ever, y'all. So the journey continues.
Thank you for listening to this episode of Clinicians for Cultures from the Align and Embrace team. If you'd like to learn more about what steps you can take towards advancing your practice of cultural responsiveness, check out our website at alignandembrace.com and join our Clinicians for Cultures community. If you like our show, remember to subscribe and share with others who may benefit. Let's build solidarity among clinicians, because together we can revolutionize healthcare.